Recently, Asthma Canada shared a survey with our community, and many of you told us that we'd like to hear directly from someone with lived experience at our webinars. And so today, we're very pleased to be joined by Asthma Canada patient advocate Jaqueline Murdoch, who will share her story of living with asthma. Jaqueline, I'm going to pass it over to you for a few minutes so you can introduce yourself. And you'll want to take yourself off mute there. Thank you.
Okay, thanks. Thanks, Jenna. I'm happy to be here as I always learn a lot from your team. My name is Jaqueline. I'm 76 as of my last birthday. I live in Ontario in Etobicoke, Toronto area, surrounded by lush greenery, at least not necessarily this time of year, but they often trigger my allergic asthma condition. Oh well. I was an IT project manager, now retired, and I transformed myself into a fitness instructor and educator. Why? Well, I figured I was getting older and I figured I needed to stay healthy, so I might as well teach it and learn at the same time. So I was diagnosed with asthma in about 2012, but was likely living with asthma for decades prior to this. I think I'm coping fairly well with the disease, with the occasional flare up when my action plan is needed. Action plan, keep it handy, really. To calm my system down, as sometimes I have to make sure that my voice doesn't give out and back to my normal state. So, question here is, what advice would I give? Well, I'm actually into exercise, nutrition, fall prevention medications. That sounds rather funny for asthma, but this is what I present in a fracture prevention as a fracture prevention educator with Asthma Canada. Yes, the formula works with all or most chronic diseases, including asthma. So when the weather turns cold, I continue with my strict routine of using my medications like clockwork and having an air purifier in my bedroom. I use a nose irrigation bottle, nasal spray, antihistamine, and I start using the humidifier in the bedroom as well. I have an air quality monitor and a humidity monitor to keep track of indoor conditions. I've always been health conscious, and I realize that everything is connected, really. Your whole body, your mind, whatever. So when you help one area of your body, you're certainly helping the other. What I do for my health of my bones, for example, is going to be good for my breathing, like good posture, alignment, sitting. Everybody sit up tall now. Everybody sit up tall? Yes, yes. It's very important. Too much slouching, right? Because your lungs need a lot of space. Standing, walking, climbing stairs. When I exercise my heart and other muscles, my lungs get a good workout as well. So I practice deep breathing daily, expanding the entire chest and abdominal cavity, expanding my shoulders all the way to the pelvic floor. It's called 3D or three-dimensional breathing. Think about it. I know my triggers, and they do get worse in winter, sadly. With the smoke from fireplaces on my daily walk, the strong odors from cooking, oil and gas stove. My husband likes to make popcorn, so that really kind of throws things off in the kitchen. We do have an air exchanger on the furnace, which helps greatly to refresh the air, which is a big help. I take indoor and outdoor air quality very seriously, as worse air quality can trigger an asthma attack. At least for me, it does. I try to minimize any chronic stress that could compromise my breathing. I make sure that I get 7 to 9 hours sleep at night, breathing through the nose, not through the mouth, protect my lungs. I eat a balanced, nutrient-dense diet to keep my body and mind healthy. So my exercise snacks in the kitchen help with balance and strength. Yay! Think about it. There's a lot of things we can do through the day to exercise, and all of this is good for your heart, your lungs, and so on. So what do I focus on? What's the biggest difference for asthma in the winter? Vaccines. I mean, really, some people may not want to hear that, but my key step for sure is to get my vaccines as soon as they become available and at the appropriate intervals. I take 5 of them altogether. I take the flu vaccine, the COVID vaccine, the RSV vaccine, pneumonia, shingles. And I've had experience with all but COVID. So far, I've managed to escape COVID. This has been a severe flu season. COVID is still with us. RSV is ticking upward, trending. I recently updated my pneumonia shot. I got the shingles shot when it first came out in 2018. I'm super grateful that these vaccines can keep us out of hospital or worse conditions. Oh, and I may add, I always mask with N95 in any public indoor space and sometimes outside just to keep my face covered so that I can breathe better, which reduces my risk of getting sick from the myriad of viruses that's important to me. So finally, what do I want to get out of this webinar? Well, a lot of things. I mean, I always learn from these people. So I'm really interested to see what the good doctor is going to say, and Jenna on behalf of them. So my goal in this hour is to listen carefully, gain knowledge and further tips beyond what I'm doing to reduce my risk of getting ill and optimize my health with the help of your team, Dr. Kaplan. Very happy to be here, and thanks again for inviting me. And by the way, this list, which is on the internet now, I'm scrutinizing this greatly, these 10 tips for asthma control. This is really cool. Great job. Thanks, team.
Oh, thanks so much, Jacqueline. That was great to hear your story and some of the things that you're doing to stay safe and healthy. And the list that you mentioned, we'll make sure to drop in the chat as well for some tips for asthma control. So thank you. We're very excited to have you here, Jacqueline.
Okay.
And now, pleased to introduce Dr. Alan Kaplan. As mentioned, Dr. Kaplan is a family physician practicing in the York region of Ontario, the chairperson of the Family Physicians Airway Group of Canada, and the vice president of the Respiratory Effectiveness Group. He also sits on Asthma Canada's Medical and Scientific Advisory Committee. And thank you very much, Dr. Kaplan. Over to you.
Thanks, Jenna. And I first want to say what a wonderful job that our patient really said, because she really said it all. And I think what I'm just gonna be able to do now is just fill in some of the gaps there. So we're going to talk about managing asthma in cold weather. And thanks, Jenna, for the introduction. So our objective is really to talk about the most common triggers during the winter and how we can avoid them, why it's particularly important to stay on top of your medication during the colder months, i.e. good asthma control is still the best management strategy for avoiding everything, and what we can do to prevent flare-ups during outdoor activity, and what to do when your symptoms worsen. So what does cold weather mean? So I went and looked this up. I said, well, basically it's when average daily temperatures are near or below freezing, which is a good part of the year in Canada. So there you go. And it does vary a little bit by region, as you know, in what way out west in BC, it's going to be a little warmer, and further north, it's going to be a longer part of the year. So good part of the year, we have to deal with cold weather in our country. It's interesting, and I'll show you some science. Don't worry about it too much. Just make some points that there are certain thresholds wherein the colder temperature seems to evoke more problems. So for symptoms, it's minus 14 degrees Celsius in males, minus 15 for females. I don't know why there's that difference, but this is what the article showed. It does show some increase by age. Mucus production was at a little bit lower. So in other words, when it gets to be about minus 12 or so centigrade, that's when you're going to start to see some more in terms of the symptoms in both men and in women for symptoms and mucus. So what are those symptoms? Well, they're going to be coughing, dry with or without phlegm. They're going to be wheezing, expiratory wheezing when you breathe out. There'll be some shortness of breath and some tightness. And these are really exactly the same as the asthma symptoms any other time of year. So it's not a different disease in the wintertime. It's just that the cold weather is one of the things that induce the symptoms. And we'll talk about that. So why? Why is it that cold weather is an issue? Jenna had alluded to this a little bit, but basically we get cold air, we get dry air, we get snow and or rain, which we had last little while here in Ontario, and we get a lot of wind and fluctuations in pressure. So that rainy weather particularly can stir up mold spores. So there's mold that occurs in the ground. It's hidden under the snow, and we usually see that towards the beginning of the spring and so on. But when you get a big melt like we had recently here a week or so ago, that mold may come up. So spores may come up. Barometric pressure can affect your sinuses, and all of these things can affect in terms of asthma flare-ups. As mentioned, colds and flu and other viruses can lead to flare-ups. Cold air is drying, which affects the lungs. I'll talk a little bit more about that. And when you're exposed to cold air, you make mucus, and that's your body trying to protect the epithelium, the lining of your lungs. The lining of your lungs, those poor little cells in your lungs that are responsible for moving gas along and mucus out. And the epithelium tries to protect those cells, are protected by making mucus. But when you make it and it's thicker and stickier and hard to clear, then you've got a problem, and that's a part of the disease of asthma. And then in addition, of course, when the weather's cold, people tend to stay inside and they stay inside for longer with the windows closed and the heat on. And therefore, there's going to be more exposure to indoor allergens. So I'm going to touch on that as well as irritants and respiratory viruses. So these are all things to think about. Now, there was a question in one of the questions that came in earlier about COPD in cold weather. So I just thought I'd touch on that right now. In COPD, cold, dry air can also evoke bronchospasm and also cause more mucus. So these same things that happen are the different diseases. So they're not exactly the same, but cold air can actually have the same effects on people with COPD. So here's some of the mechanisms that do that and the triggers. We can, when you breathe in, now Marina mentioned breathing through her nose, which is great. But of course, when you breathe through your nose in cold air, that is going to be a good filter, but it's also going to then cause rhinorrhea, which is runny nose and congestion in the nose and sneezing. And of course, the upper airway and the lower airway are related. So when you have irritation of the upper airway, it's going to irritate the lower airway. In addition, when you have cold air, it can cause bronchospasm and it can cause some damage of the epithelium, those important cells of the lining of your lungs. And over time, that can change the airway wall structure. And then we can get reflexes. Actually, it's interesting that if you cool the facial skin and cool the upper airways, that actually can cause bronchoconstriction as well, it can cause the spasm. So that's a very interesting thing. These are reflexes that your body have, and their protective reflexes is really what they're for, that were developed many, many years ago to try to protect us, but now they can just evoke worsened asthma. So pathophysiologically, that dry air, winter sport athletes have a particular problem, and it's much more common to have asthma in athletes who train hard, especially in winter sports. Now, this endurance of exercise with cold, dry air leads to loss of water and heat from the respiratory tract. And this can happen both during the season as well as during the all-year training. So that hyperpnea with cold air is a different kind of stress to the airways than most of us get unless you're an athlete. So when you're outside and breathing cold, dry air for a long time, that's actually a stress to itself. And that's why winter athletes have a high prevalence of asthma and respiratory symptoms. And in addition to that epithelial dysfunction that occurs, you actually got inflammation, neutrophil index. So you get different inflammation occurring than when actually people do fancy tests like bronchoscopies and testing like that. And when all this happens and you get this irritation and the influx of white blood cells, then you get these cytokines, which are inflammatory mediators that become upregulated as well. Now, these have been tested in animal models, in horses and in mice and so on. But what you're seeing here is that we get this inflammation that occurs. And as most of you know, inflammation is the bottom line that comes to asthma problem. That's the underlying issue. This was an interesting article that I found that this is from Finland as well, that looked at a colder winter than normal when the average is much more below that -4.5 degrees. So those cold winters compared to a warm winter can increase the risk of the new development of asthma in the population by 41%. So we probably don't have to worry about that in Finland and Canada so much because it's cold all the time in our winters. But it's interesting, a warm winter may actually lead to less asthma. A cold winter may lead to more new cases of asthma. So with all that, we've talked about cold weather and so on. I'm going to come back to that as well. But what do you think the most common source of asthma triggers are in the cold weather? Well, I won't keep you waiting. It's indoor air quality because we're inside so much more. We take 15 times more air than food or water every day. We spend 90% of our time indoors. We take 20,000 breaths every day, and indoor air is actually dirtier than outdoor air, which is kind of scary. And many, many years ago, when the wall came down in Germany, we had a situation where we had industrialized West Germany and East Germany that was the communist side, and they said which actually has worse asthma. And they actually found that it was the actual industrialized Germany that had worse asthma because the indoor air quality was worse, despite the fact that the communist side actually had wood stoves and so on, but they had good ventilation in their homes, where the industrialized Germany had significant sealing and sealing everything in. So that actually keeps the bad stuff in, and we do that here in Canada to have a lot of saving of our heat costs and so on, but that can have costs in terms of what we breathe in. So I want to come back again. I'm sorry, I'm going to show you some scientific-y looking stuff, but this is really what we're talking about here. The top of those respiratory epithelium with the little cell called cilia that move things along. And those epithelium can be damaged by cold weather, by bacteria, by viruses, and so on. all of which leads to cells like macrophages and mast cells and white cells coming to try to protect that epithelium, all of which leads to those cytokines, those different things, the ILC2 and a bunch of others that lead that. And we know a lot about this more now because of the biologics we use for asthma target some of those. But you can see this whole process here that you get exposure to a barrier damaging agent, you get inflammation, then you get opportunistic pathogens colonizing, because when you denude that epithelium on the top, you actually get bacterial invasion. And that over time can lead to an immune response and then overall a defective barrier and more inflammation. So that's the theory here. All these exposures will do that. So indoor exposures, there's a lot of things that can do this. We'll talk on some of them, and I'll do it quickly for time. But one of the things that we have to think about is things like cleaning and disinfecting products. There's going to be dampness and mold. There'll be pesticides for those of you that still um, keep things in the home in terms of plants, and volatile organic compounds, which are certain chemicals. And these health effects can occur right away, but they can actually occur years after exposure as well. And as I mentioned, wood stove, is one of the things that can do that. So we have to think, if we're going to use a wood stove, we have to make sure we have ventilation, because all that smoke can actually damage the epithelial barrier as well. So let's talk about that. So when I talk about that, we also think about things like incense candles as well. So this is just a sort of, if you look at your house and think about all the things that can cause you problems, and I don't want to make us all too neurotic about this, but there's certain things we should be thinking about. We have to think about stuff that can come in from outdoors. Well, we've talked about that. Indoor allergens, that you can be allergic to, such as, pets, cats, and dogs. House dust mites, which are little tiny insects that live in your bedding and your cushions, and we're actually allergic to their excrement. So if you're allergic to them, you want to make sure to keep your not too humid at home, and wash your bedding and so on. And then, of course, other pests as well. Cleaning agents, volatile organic compounds, tobacco smoke, and other chemicals can be exposures. There's more and more evidence about microplastics being a problem, and we don't have time to talk about that today, but something for you to read about. There's air quality in terms of carbon monoxide, nitrous oxide, that's from pollution outside, but inside from indoor fireplaces and heaters and cooking stoves. And then bigger pictures, things like asbestos in the walls and radon from the ground, which is radiation, increases your risk of lung cancer. So there's a whole bunch of things that can happen here. So I won't go into it too much. I'll touch on a few of them. Cleaning agents are one of the first things we talk about, and it's good because you want things to be clean. But some of these agents can actually breach the epithelial barriers, even at very low concentrations, and therefore cause inflammation there. So they can cause new onset asthma or exacerbate asthma. So part of it's going to be, how often you use it, how strong it is. There's a whole list of things here that can do that, in terms of sprays, perfumes, cleaners, softeners, even baby products, and disinfectant wipes can do that. So somebody's saying, good, that means I shouldn't clean, because therefore, if I don't use the cleaner, I won't be exposed to it. That would certainly be my answer. My wife would yell at me, and she'd say, well, there's other things we can use, like baking soda and vinegar and things like that, hydrogen peroxide and lemons. But you can use the other stuff as well. All that's fine. Just make sure that the air is ventilated, and an air purifier, as was mentioned, also is going to do that as well. So just, you want to make sure that you're not trapped in a room with tons. If you can smell it that strong, your cleaner is strong, you probably want to think that may be damaging your lungs. And again, maybe thinking like even wearing a mask at that time might be worthwhile. Opening the windows, even in the winter, is probably the solution to this. Now, the cost of that is going to be your heating bill goes up and you're going to be cold. So everything has a cost benefit analysis. But think about ventilating when you're using a lot of these chemicals might help you. And if you want, you can use a screen so stuff isn't going to come in. Well, dampness is a big deal, right? So, dampness leads to mold growing in the homes, and that can come from leaks and condensation or improper insulation. Especially this time of year, people tend to use humidifiers and things like that, and you get growths in humidifiers with fungus and bacteria and so on. And, even during infancy, we know that exposure to mold or dampness can increase the risk of asthma and rhinitis. So those humidifiers that we're so fond of using can lead to mold on the walls or the ceiling, as you see in the cartoons, but also lead to secondary infection and moving on to asthma through childhood and adolescence. So there is a value for having some humidity in the home. When we have the heater on, it dries everything out, as you well know. And if you dry things out too much, that's bad for your house. It's bad for you. It makes your nose dry and it makes things bleed and so on. So you do want to humidify, but you want to make sure you keep the humidity down. I'll touch on that. For those of you that saw this, this is called The Last of Us. This is a mini series, and this was an invasive mold that took over the world. I just thought for you science fiction kind of people, I thought I'd throw that in. So the mold cleanups depend really on how big it is. So if you've got a little patch like this, it can be cleaned up. If you got bigger patches, eventually you have to take the entire area down and replace those areas when you have much bigger ones. So again, you got mold, get some help on that because this is actually, you're only seeing the tip of the iceberg when it comes to mold. There's always going to be more. Well, we can't talk about indoor allergies without talking about pets. So, dogs and cats, while they're very cute, if you're allergic to them, if you're not allergic to them, not an issue. But if you're allergic to them, you want to minimize your exposure to their dander and to their fur. Air cleaners are of value, more particularly for this, because the FeLD and the dog allergens are actually big, and they get trapped in in the HEPA filters. House dust mites, I mentioned, you're allergic to their poop. So, if you're sleeping on a bed with lots of dust mites, you're inhaling dust mite poop all night long through your pillow and your bedding. It doesn't matter if you're not allergic. It's microscopic. You can't see it, feel it, or taste it. But if you're allergic and you're in bed for 8 hours, you may inhale a lot of that. So things like dust mite covers can be helpful for that. Okay, cover with the pillows and the mattress. Keep the humidity down. 50% is too high. You want to keep it down to 40% or low. And what we also do recommend for a lot of our kids to have this is take the stuffed animals, put it in a plastic bag, and either throw it on the back porch in the winter or throw it in the freezer because you freeze these dust mites or fry them, and that kills them. And some of us are going to have issues with cockroaches depending on where you live. And obviously, if you're allergic to if you're not allergic, they're kind of gross, but they're not actually harmful. But if you're allergic to them, you want to make sure to eradicate them. Now, we just had holiday time, and a lot of us have celebrated our holidays with lovely trees. However, those trees were cut in October, and then they're stored, and therefore they're going to get mold and dust building up on them. So, before you actually bring the house inside, if you have asthma and issues like that, you may want to think about letting it dry a little bit before you bring it in the house, using a leaf blower to give it a good blow off of all the dust and stuff that's there before you bring it in the house. And maybe someone else should do it if you're the allergic one. When you're handling it, you want to wear gloves and a long sleeve shirt so you don't get the sap on the skin, again, depending on your degree of allergy. But as you can see over time, at the end of the season, it's going to look like the middle picture, and therefore it's time to get rid of that and not leave it there and be lazy about leaving it in the house because it's going to be a potential allergen for you. What else? Realize that when you have an artificial tree that's going to be full of dust when you put it away from year to year, so vacuum it. Recognize that poinsettias and holly and mistletoe can contain dust mites or mold. And again, we talked about the chemical fumes already, and candles and things like that. And all the scented stuff that we like to see and like to smell during the holidays might actually be a precipitant for some of us. We've talked about smoke inhalation, being it from wood fires or the fireplace. And of course, I can't be complete without talking about smoking cessation and making sure we don't smoke. Carbon monoxide, again, not really so much of an issue when it comes to our asthma, but recognize that a lot of these heaters that we use can lead to the accumulation of carbon monoxide. And please, please, please get a carbon monoxide detector for your home. It might literally save your life from something that you don't feel or smell until it's too late. Then viral infections. Okay, so I mean, that's a big issue. And again, I thank everybody for all discussing the idea of vaccination. So yes, we should wash our hands. Yes, we should use cleaner. Yes, we should mask. These are all very important, and they really make a big difference. When we went through all the big COVID lockdowns and distancing and masks, our incidence of influenza and RSV went down to practically zero. But of course, as we start taking our masks off, we're going to start coughing on each other again and therefore lead to these illnesses. So what vaccines should be included here? And these were mentioned already. And these are recommended by not just me personally, but by GINA, the Global Initiative for Asthma, GOLD, which is the Global Obstructive Lung Disease, including cardiologists, rheumatologists, diabetes specialists. All the major groups are recommending vaccinations in our high-risk people. So seasonally, influenza, RSV, as mentioned, COVID-19 is probably a bit of a seasonal, but it actually does go on all year. Pneumococcal is all year long. Zoster is all year long, or shingles. And the only one that you didn't mention in terms of your 5 vaccines is pertussis, and make sure you're up to date with also whooping cough, because if you have a grandchild, they could potentially bring it into your home. Okay, so if you have, this depends a little bit on age. Everyone should have influenza. Everyone should have COVID-19. RSV is indicated over the age of 50 right now, with the exception of RSV vaccines for pregnant moms. Pneumococcal, all children get as part of their vaccination package then. And then depending on, again, over the age of 50, our adults should be sort of boosting for it. The idea of shingles, is really that over the age of 50 mostly, but if you're high risk, it can actually incur at higher risk even at that. And whooping cough, of course, can happen at any age. So what does NACI recommend? NACI is National Advisory Committee on Immunization over the age of 65. Not only do they recommend influenza shot, they recommend something that's a little bit stronger, because as we get older, sorry to tell you this for those of you who are older in the audience, but your immune system gets a little bit tired and doesn't work as well. Therefore, if we give a standard dose influenza, you do get a response, but if you give an enhanced influenza vaccine, you get a better response. So it's either going to be the high dose, which is called Fluzone, or the adjuvanted, which is called Fluad, or the new recombinant Flublok, which isn't available in very many places. But the bottom line here is get one of these, preferably if you're over 65, and if they're not available, then get any that's available. But again, over 65, I would suggest getting the enhanced vaccine if it's available. For RSV, the recommendation is if people, really over the age of 60, if they have high risk, it's a single dose. Right now, it's a single dose with no booster needed. It can be given with anything else as well. And one of the two is actually indicated all the way down to 50 years old right now. So 50 years old if you're high risk for RSV. And right now, there's just no indication for it below the age of 50. That doesn't mean it wouldn't work, because I think it would, but right now we don't have that indication yet anyhow. What are those clinically significant conditions? Well, they include a bunch of things that you can see here: significant obesity, neurologic issues, liver, kidney, being immunocompromised, diabetes, heart conditions, and they do include lung disease like COPD and asthma. So make sure that you in high-risk populations are getting vaccinated. And I probably should just touch on the whole concept of using the monoclonal antibodies for babies, which we're giving now for babies. So what we've learned here is that RSV infection is actually one of the things that may increase the risk of asthma, especially if the parents have a history of asthma. So what you can see here is the development of asthma in children over time. And you can see the green is no RSV hospitalization or parental asthma. You compare that with the blue, they've had RSV hospitalization and paternal asthma, and the red, RSV hospitalization and maternal asthma, which are the incidence of asthma. So there is, to me, no question that RSV infection is one of the risk factors for developing asthma. So if we prevent this with medications like Beyfortus, or a new one's going to come next year, there's another monoclonal probably coming next year to Canada, to our newborns, we can actually decrease the development of asthma in the first place. As far as COVID, it's recommended anybody can sort of have it if they want it, but they particularly recommend people with underlying medical conditions over the age of 65, pregnant women, and so on. So that's particularly there for that. So again, I think COVID is a reasonable thing. I know that this sparks a lot of controversy and a lot of people get upset about this conversation. I've had mine. I think it just makes sense for high-risk people to get it. NACI for pneumococcal vaccines, there's a couple of different kinds, and you had said that you'd updated your vaccine. So there's Pneumo 20 or Prevnar 20 is currently the one that is paid for by the government over the age of 50 for high risk. And Pneumo 21, or called Capvaxive, is a newer one for people over the age 65 the government doesn't pay for. But one or the other is really what you want to be getting. So you want to get your pneumococcal shot over the age of 50 as well. And I mentioned whooping cough, or Adacel, which has whooping cough in it. It's one of the tetanus shots, but tetanus with whooping cough, because we still get outbreaks of this every year. Make sure you've had your shot every 10 years, as you're supposed to have. And then zoster. Well, what does shingles have to do with lungs? So I mean, it's an interesting thing. Well, of course, shingles can happen to anyone. But in fact, from this work done by some colleagues of mine, they actually looked at the risk of having shingles altogether and shingles complications in people with asthma and COPD. And let's take you to the middle thing that's circled there, where in people with asthma, they have a 90% increased risk of getting zoster or shingles around the eye. And having neuralgia, which is the pain from shingles, in COPD, it's a 50% increased. and it's a 20% increase in asthma. So we don't want people to get zoster in the eye, can lead to blindness. We do not want to get post-herpetic neuralgia, which can in some people be horrible lifelong pain. So get your shingles shot, please. There seems to be an increased risk in people with respiratory disease. And you can have a whole bunch of shots at once. So you can go back if you want, but please go back and get them. Otherwise, you can have a whole bunch of shots at one time, depending how many arms you have. Not really. Of course, we only have 2 arms, but you can literally have 2 shots in each arm, in both arms, if you really want to, as long as they're an inch apart. So again, get vaccinated, please, and you can have more than one at a time. And certainly during season, get your flu and COVID at the same time, as many of you already do. Okay, so moving back onto cold air then, which is really the topic we're talking about, what can you do about that cold air? Because it can stimulate an attack. So you can keep your mouth and nose shielded with a scarf or a mask, as was mentioned, N95, to warm the air before you breathe it in. As you know, we can use a short-acting albuterol, which is the American name for salbutamol. Sorry, I should change that at the first sign of symptoms. And stay inside when you can, because breathing warmer air will help open up your airways. But of course, then it's a balance between the warmer air inside and the allergens inside and going outside with the cold air. And of course, if you're having problems with cold weather, then we need to talk to your physician about that. I'm going to give you some advice, but please don't exchange that for a discussion with your doctor. Now, I talked about cold temperatures are dehydrating, so I think we just need to add water. So again, you can do a mister, you can do a vaporizer, but again, remember, not too moist. Okay, keep that humidity down at 40% or below, because it can cause house dust mites proliferation and it can lead to mold. And it can also, if you have too much water, it can actually damage the wood around your windows, which will be expensive for you. You don't want that as well. You can use things like nasal saline sprays and rinses and things like that can actually be helpful as well to lubricate the upper airway. We talked about the nose being a wonderful filter there. If you humidify it, it's going to actually help that. Okay, so can an asthmatic person exercise in cold weather? I kind of like that cartoon. I hope you appreciate that cartoon. You know, those people that run around in shorts in the middle of winter, I never understand them, but okay, good for them. So what do? Well, again, breathing through your nose makes a difference because you're warming the air as you breathe it through your nose. And that has actually led to less bronchospasm during the performance of activity because it's warm and humidified. You can use a mask. There's actually fancy heat exchanger masks you can actually purchase, but that's probably more than most of us want to do, but that can actually be of value as well. So you just want to warm that air in by breathing through your nose or covering your mouth as you're breathing in. And N95 would work wonderful for this as well and make maybe like a little less mess. The other thing you can do is consider the timing and warm up. So what happens is there's a period of a refractory phase. So if you do a 15 to 30-minute warm up followed by a 15-minute rest period, and that's the point if you use preventive medicines, you put it in, and you start your competition about 15 to 30 minutes after the medication administration, what happens is that this refractory period occurs. So you start the exercise, you release a bunch of catecholamines and prostaglandins, which then prevent things like mast cell degranulation, which is all part of the pathophysiology of an asthma attack. And you're protected for that half hour or so after that stuff all kicks in. So a warm up and then a rest and then your medication is the secret. So remember that concept. Okay, if you're going to be exercising in the cold weather, you warm up, okay, and then you take a little bit of a rest and take any preventative medication. Usually it's going to be beta agonist, short-acting beta agonist, or I'll talk about those choices, and then exercise. And it's just the pathophysiology of this is that there's going to be a refractory period where you won't get as much symptoms. So that may allow you to exercise in the cold weather where otherwise you're not able to do that. Warm up first and then that rest period for a few minutes. So overall, how to deal with that cold weather? Well, be careful or potentially avoid, depending on how sensitive you are to it. Certainly when it's less than 20 degrees. Remember the wind factor, because that's going to make sure it's going to blow into you a lot colder. Try to avoid those sudden changes of weather. So warm-up exercises, preferably try to warm them up, outside or in a cooler area than just inside your house. So if you have an enclave or a little front porch or something that you can do it in there, do your warm-up there. Because, when you suddenly cool down, it's an issue. When you suddenly warm up, it can also lead to swelling and bronchoconstriction. So a little bit of a cool down is going to be important as well. And again, wearing that mask or scarf if you can. Now, then where do we go? And, if you're Canadian and you're You may have some affinity to hockey, and if you go to indoor rinks, there's going to be a lot of release with ice resurfacers and zambonis with carbon monoxide and dioxide and nitrous oxide and other things that can irritate your lungs. If you're a swimmer and even if you go swimming in the winter, there's certain chlorine and certain other things that can be in the water there to keep the water clean. But again, if you're sensitive to it, it can also stimulate your asthma. So think about these things as well, depending on where you're going. Okay, so pre-exercise medications, it's usually going to be short-acting beta-2 agonists. The classic, of course, is Ventolin or Bricanyl. Those are the brand names for it. Long-acting, we can tend to use mast cell stabilizers. We don't tend to have very much anymore in Canada. They're drugs that we used a long time ago. We don't really use them anymore. Leukotriene receptor antagonist, the one we have in Canada is called Singulair, can actually be of value for pre-exercise prevention as well. It's a pill. Now, the other thing you could use, and you hear a lot about the concept of budesonide formoterol, that's the red one in the top corner. Some of you may be taking that. It's different than some of the other ICS-LABA combinations or inhaled steroid long-acting beta agonist combinations because formoterol is both long-acting but also rapid-acting. So because it works quickly, it works just as fast as salbutamol or the classic Ventolin you've all heard of. And you combine it with the inhaled steroid, it works quickly to improve asthma control, to treat symptoms and keep them away because you're treating the inflammation at the time it happens. And it's also going to reduce exercise-induced bronchospasm with this study by Lazarinus. So we can actually use your Sympacort as your pre-exercise medication as well if that's the drug you're taking. And here's just a little bit of evidence for that. So on the top here, it's after stopping the test, and the hatched straight line is the Sympacort, and you can see that the recovery of the FEV1 is better than if you just use the beta agonist on its own. So beta agonist certainly works, and it helps improve things when you take it, but the Sympacort works better, and this is, again, after the exercise further. So in summary, no too much science, but in the summary, some things we can do. We can avoid triggers as best possible. We can exercise regularly. We can do a warm-up. We try to avoid exercising when there's a lot of pollution. Allergen is really not the issue for the winter, but extreme temperatures. Mechanical barriers we talked about. If you've got an infection yourself, if you've got a virus, and you say, well, I want to push through and do my exercise, be cautious of that because that infection is probably already stimulating your asthma and causing some inflammation. And especially cardiovascular exercises can actually then be a precipitant. And understand your self-management. I mean, the first thing that we saw today was an action plan, which is fantastic from our patient speaker, and make sure you have one of those as well. Medications, make sure you're taking your regular medicine. Make sure your asthma is controlled. Make sure you're taking your maintenance therapy. You can use your bronchodilator before your exercise. Make sure you're taking it properly. Ensure that you understand how to take your medication properly. And unfortunately, the majority of people that I see that get sent to me with their asthma because maybe it's not as well controlled are taking their medication improperly. So please, there's YouTube videos for all of them. The websites have links to the videos for this as well. Please have a look at them. Take your medicine. Even when you're feeling well, take your medicine, please, because that's what keeps you controlled. And of course, there can be other conditions that can worsen your asthma. So we've talked already about the rhinitis, the upper nose, and the stuffy nose, the upper airway can lead to your asthma. But things like heartburn and acid ingestion, if you have that regularly and you're choking on it, can worsen your asthma. So all of this stuff can help prevent your exercise symptoms. And this is our GINA recommendations. What do we say is control? Control is you don't have symptoms more than 2 times a week. You'd never wake up at night. You don't need your reliever more than twice a week, and you have no exercise limitation. If all those things are true, then you're very well controlled. Right? Now we also talk about other risk factors for poor outcomes. That's not part of this conversation, but you want to overall make sure you're taking your medication, you're controlling your other conditions, and so on. So again, you shouldn't be needing your bronchodilator. If you need your bronchodilator, you need your acute rescue frequently, you're not in control. Right? That's really important. So our goal should be not to need our rescue medication ever. To take enough maintenance therapy, you don't need it. So what happens if you're in control? Well, this is a study looking again at from finished study, looking at asthma control and cold weather outcomes. And if you look at the ACT, the lower the ACT, the worse the control. So the lower that number, okay, the worse the control. And what you can see here is the white box where the number's lower versus the black box. They're having much more symptoms in the cold weather, both in men and in women that are doing that. So having good control is probably going to be the most important thing that's going to prevent cold weather related symptoms. So you're aiming for perfect control. Okay. So overall, the highlights of this are: this is cold weather will aggravate symptoms. Poor asthma control makes it worse. Weight is part of this as well. So that's a whole other conversation in terms of if we are overweight, particularly if we're obese, that makes asthma a little more difficult to actually manage. And that's perhaps time for a topic for another time. And again, if you're smoking, that's going to obviously worsen your control and worsen the outcomes. So as a clinician, when someone's not in control, I'm going to look at, and this is from our GINA rec guidelines as well. We're going to, first of all, are we taking our medication? Are we taking it regularly? Are we taking it properly? Is it asthma we're talking about? Get rid of some of those risk factors and triggers that we talked about, whether they're allergens or cold air, which we're talking about here, and then follow up. So these are the steps that we go through to try to ensure that the control can be managed. So here is the GINA guidelines. You may not have seen this, and I throw this in here just because I want to point out that internationally, our GINA, I'm part of the GINA Scientific Committee, and internationally, we're recognizing that the preferred controller and reliever is to use a combination of inhaled steroid and an opener, rather than just using the SABA, the Ventolin alone. It's not that Ventolin is a bad drug. It's that Ventolin, if it's used without treating the inflammation of the swelling in the lungs, can actually lead to bad outcomes. So if we put it in combination, it actually works better. And I've said you can use ICS formoterol as your rescue therapy, as well as pre-exercise, which is this combination. And that's what it sort of looks like, ICS formoterol. In the United States, they actually have a combination of ICS salbutamol. So it's a slightly different product. We don't have that here in Canada. We call that AIR, or anti-inflammatory reliever. Right. And do you have an action plan? Well, this was touched on already. If you don't have an action plan, then please speak to an asthma educator about this, speak to your physician about this. There's many places you can get an action plan, such as at Asthma Canada. You can see the green is people are well controlled. Here's your regular medication with notes. Yellows, things are getting worse. If you have a peak flow meter, you can measure it objectively. But if you're starting to grab your beta agonist, if you're starting to have some symptoms, what are you taking now? What do you increase it to? And the recommendation is to quadruple your inhaled steroid for trouble. So quadruple for trouble. But if you're having more problems and you're having more shortness of breath and you're really getting sick, of course, you want to take a whole bunch of reliever and make sure you get into a hospital or a clinician's office so they can look after you. Now, what about biologics? So as you know, there's many different biologics out there. These are medications that work on that cytokine level I mentioned earlier. These are injectable therapies. They're very expensive, but for the right person, they take someone who has severe life-limiting asthma to living a normal life. But they're expensive. They're $25,000 a year, and there's definite indications for it. But sort of looking at this in just terms of a winter exacerbation, to keep to the topic, they actually looked at this group of people with omalizumab, which our oldest biological Xolair. And you can see the people that were on the Xolair had a much longer time without having an exacerbation, those that did not have it. So the rate of exacerbations in the winter. So the bottom line is the biologics will also decrease the inflammation, get the asthma in control, and decrease winter susceptibility. So overall, this is a nice review from Asthma and Lung UK. Protect your airways from cold air by making sure the air is warmed up. Breathing in through your nose, wearing a scarf or a mask. Okay, it's a good idea to keep your reliever with you at all times, be it going to be your SABA or your ICS formoterol, which is called Symbicort in Canada. Check the weather and think about whether or not it's a good day to go. I mean, many people do walks in the malls and things like that, and they do that because of the weather. Again, if it's at minus 20 or below, you might want to think about not exercising outside. If you're worried, should somebody go with you to check on you? And again, depending how sensitive you are, keep everything warm. It's not just worrying about your lungs. You have to make sure to keep things warm because if you're chilled, it may have an effect also on the total degree of inflammation in your body. And to keep warm, wearing lots of layers is better than wearing one thick layer to keep yourself warm. So these are some good advice from Asthma UK. So my overview here is, and important things are, take your daily controller medication as directed, right? Please, and I know that the first thing that many people do is when they feel better is they say, well, I can stop taking my medicine, or I start to forget it because I feel well. If you're going to be exercising, make sure you have a quick relief inhaler with you. Okay. If you're going to exercise, have a plan beforehand. Okay. Can take that warm up time we talked about and then take your inhaler beforehand. You want to wrap a scarf around your nose or your mouth or use a mask, as was mentioned. Try to acclimate to the cold air. So warm up in that cold air. Hydration is really, really important. And stay healthy, please. Get your respiratory vaccines. Wear a mask in public places, as was mentioned, to try to prevent getting ill because we don't have vaccines against every single virus, unfortunately. And sometimes our vaccines are not as perfect as others. This year, we've learned that influenza, we didn't quite get the mix right. So we do have a whole clade of influenza illnesses that actually are not ones that were covered with the vaccine. That doesn't mean others weren't covered, but we've had the breakthrough of some that were not covered. So with that, Jenna, I'll stop and I look forward to a conversation.
Great, that's wonderful. There's a lot of fantastic information there, very comprehensive. So thank you very much, Alan. And here, let me just throw up my slides. And Jacqueline, if you want to join back into the conversation as well. And very briefly, before we move into the Q&A, I'd just like to take a quick moment to highlight Asthma Canada's Asthma and Allergy Helpline. This is a free bilingual confidential service where you can connect directly with a certified respiratory educator about any aspect of your asthma management. No questions too big or too small. And so we won't be getting to all the questions we have in the Q&A right now as we're focusing right now on the cold air. So any of those questions, we'll be happy to direct to that helpline. And you can find the contact information for that in the chat.
I was just going to say on top of that, Jenna, really important that these educators are people who have been well trained in asthma. They've gone through courses. I know because I've written some of those exams. They have to know how to teach you, and they also have to know the guidelines per what they are currently. So these are people that are really going to educate you with up-to-date information, and they can help you with things like creating an action plan for yourself that you can then take to your doctor to stamp that it's a good idea and so on. So please take advantage of these educators. They're there for you to help you.
Absolutely. Thank you for that, Alan. And again, as we mentioned with Asthma Canada, our series, everything's free of charge. So if you call us, email us, we'll set you up with one of our series across the country. So that's great. All right. And with that, we'll open up to a couple of questions. We can start with a few that have come already into the chat. But if you'd like, if you have any questions, you can drop them into the Q&A feature. We'll try to get to what we can. So we can start right now. With some questions, just looking here down here, does cold water plunging affect asthma lungs?
That's actually a very interesting question. I would have to look up to give you a for sure answer on. But my initial thought on that would be no. It can evoke a cardiovascular response. It can evoke a bradycardia, and people have been known to actually pass out jumping into cold water. But I don't think it's going to affect directly the lungs. Now, there is something called cold water urticaria, where you jump into cold water and you get a massive histamine response. So while it's not asthma, it's kind of like having an acute allergic reaction, which might involve some bronchospasm, but you'd have to have that condition. So unless you got cold urticaria, I think probably not. But it doesn't mean it can't cause other problems like getting cold and getting bradycardia and passing out.
Thank you. Interesting. Does cold water exacerbate asthma comorbidity? So things like your mental health, obesity, other respiratory issues.
Cold air, I think you meant rather than cold water. But
sorry, cold weather, yes.
Cold weather.
Thank you.
Yeah. When cold water would probably do some of these things too, but we'll get into that. If you don't have a hot shower, that's going to worsen your mental health, I'm sure. Does cold air, I mean, I think there's a lot of issues with sunshine. So we know that when you reduce the number of hours of sunshine, that does affect people's mental health. It affects my chickens laying. They don't lay with reduced number of hours of sunlight a day. That's an interesting thing. I don't know if you guys knew that. So chickens they reduce laying during the decreased time of day. But same with people. If you don't have that amount of sunlight, there are people that get depressed, and it's time of year related thing, it's winter related seasonal affective disorder, it's called. And there's actually things like light therapies that you can actually do if you're one of those people. So I'm not sure it's the cold weather itself, but it may be the decreased amount of sunlight. But what cold weather also does, of course, is it makes people stay inside, and therefore they may be less social. And if you're less social, you may have a higher risk of having mood issues. I guess if you're inside not exercising, it may cause your weight to go up because you're eating and not doing your exercise. So that could happen. So I think there's probably going to be some overall effects of cold weather. However, most people that live in Canada learn to deal with those things because it's been our whole life this way. and you've had to deal with it. But if you haven't learned to deal with it, it's something to think about.
Thank you. Is there an ideal humidity in basement bedroom or bedrooms to both keep airways healthy, but also to prevent mold? Because this person's concerned about adding a humidifier to their bedroom might contribute to mold, making an issue worse.
Yeah, so very, very important thing because many of us use humidifiers, because it's dry, because the heat's on and it dries the house out. Absolutely. What you want to make sure though is not make it too moist. Too moist can lead to mold spores growing. Too moist can lead to dust mite proliferation if you're allergic to dust mites. Again, if you're not allergic, it doesn't matter. But it can also ruin the wood around your windows and stuff. So the number I would say is about 40%. Okay, 40% is a good number. It's not going to be too high to cause these things to grow. So you want to keep it at 40%. Below 40% probably may not be enough to be helpful. So 40% would be the number I aim for. And get one of those little things you can put on your shelf, and it can actually tell you humidity all the time.
Thank you. And Alan did kind of mention this about transitioning people's bodies from, indoor environments to outside cold weather when coming from indoors and outdoors. We might want to reiterate that. Or Jacqueline, I was going to ask, is there anything that you do in particular when you're going from indoor warm air outdoors to help you maintain your control?
Yeah, so I mean, listen, we're all busy, so you're running. So the last thing you have time to do when you're going out in the morning is sit, okay, I'm going to spend a few minutes outside before I get in my car and go to work, or you know, so fine. I mean, you do what you can, but if you can actually spend some time, getting yourself acclimated, that's worthwhile. If you have a little enclosure in the front, which is not heated, but it's cooler than outside, that give you a few minutes in there. So maybe, you go out there, you put your boots on or so on there to give yourself a chance to breathe in a little bit of cooler air, but not ice cold air, and so on to do that. So if you can, it's worthwhile, but especially if you're going to be planning on going for a long walk or exercising, it's worth the trouble.
Great. And Jacqueline, is there anywhere do you turn for asthma support, during the winter months, talking to your physician, doctors, anyone else, friends? How do you kind of get support and feel like you're engaged with managing your asthma in the cold weather?
I'm very fortunate that my family doctor is actually very familiar with and has taken a number of courses with regard to asthma, COPD, and all that's to do with breathing. So he's my main resource with regard to it. I also have the fortunate ability to work with a breathing specialist. So every 6 months, I get tested one way or the other to make sure that because it does vary over the year and stuff, and I keep a close eye on it. So the spirometry tests I think are really important to determine am I breathing at my age group, which I think is kind of a funny way of putting things, but at least to be breathing properly. But really, I do go back to my training with regard to three-dimensional breathing because we need to slow down our breath. We need to be able to de-stress. We need to have like 6 to 12 breaths per minute, breathing through our nose. All these things are really helping. But as far as going outdoors, I do check the temperature. I check the humidity. I check the air quality. I make sure I'm well equipped to go outside with all of the extras because I do like my daily walk, and I think it's important for my constitution. And hopefully, it's sun shining. We see a little bit today, which I think is very hopeful. But nonetheless, yeah. And then I get to get socialized with people. But yeah, and I keep a mask handy because if the weather's too cold or too dry, it does actually help me breathe properly so that I don't end up with laryngitis.
And so we talked about, of course, a lot of things that are generalized for the entire population of things that are good. But we have some questions from parents and caregivers. Is there anything in particular to be helping with their kids in cold winter and cold weather?
Well, first of all, I took the opportunity to look up the cold water and cold air and drinking. And much as I described to you the concept of the reflex that cold exposure to the face can cause bronchospasm, so can immersing your body in cold water or drinking a cold drink. They can also trigger that. I think it's probably not a huge issue for most people, but in theory, I suppose someone who's very sensitive or someone who's very poorly controlled might have that issue. So for children, to answer that, so children, how do we protect the children from cold air? Well, I think it's much the same answer. It's number one, keep the asthma as perfectly controlled as you possibly can. Avoid the triggers that are going to worsen it. Be adherent to our medication. Ensure we're taking our medication regularly and properly. Number one. Number two, children are going to go out they're different than us. They're going to go outside and play no matter what the temperature is, right? So again, try to get them to do a little bit of warm up before. Try to get them to be before they go running full speed, because children only have two speeds, right? On and off, right? So before they go running out full tilt, get them to just do a little bit of warm up and so on in the cold weather before they go from 0 to 100. Let's them work at 20, yeah, at that kind of speed first. So I think those are the basics really that are there. Will they wear a mask over their face? Probably not. Will they wear a scarf over their face? Some kids are great at it, and some kids will take it off as soon as you, the parent, turn your head, right? So you can try those things as well, and if they find it valuable, maybe they'll do that. The difference with children often is, especially teenagers, going to be peer pressure. So I can't imagine most of our teenagers are going to sit there and properly wear a mask just because you tell them as the parent. But that's just one of many things that our teenagers don't listen to us about. But again, we could make that recommendation.
That's great. Okay, so we're tight for time, so we'll do one more question here that I see. If I only have seasonal asthma, do you recommend stopping treatments during spring and summer months?
Oh, what a question. That's not a short question, Jenna, but
I'm
I can tell
sorry.
you what our GINA recommendations are. Our GINA recommendations are that asthma is a chronic illness. Okay, which means you have asthma all the time. Now, that being said, do you need to be treated all the time? Well, it depends on how much inflammation you have. So if you really truly have seasonal asthma, so you're only ever allergic to grass, let's say, and otherwise you're perfectly fine the rest of the year, and and you truly have seasonal allergen, then it would be reasonable to just treat at the time your inflammation is bad, which is going to be during that season. So yes, there are some people that have truly seasonal disease and therefore taking treatment just before the season starts, not after it started, because then you're playing catch up before the season starts and carry it through the season and then discontinue it when the season is over. The problem is that most people have a combination of things. Very few people have true single allergen mediated illness. So they may think that's what they have. And again, it's something to converse with your doctor and or your allergist about if you have an allergist to do be testing, because many people should have testing done to see what you're allergic to. So the answer is yes, you can just treat for the season. If you truly have that disease, please start before the season and carry it right through the season because you want to prevent getting sick. You don't want to play catch up.